This has been a fantastic year for breast implant health. But the FDA in October stated that they need to, meaning plastic surgeons and manufacturers, must give informed consent of what breast implants may or may not do, so that the whomever is receiving the implant is fully informed of the risks. And the risks are that there are man-made cancers specifically, but not only BIA, ALCL, which is a lymphoma. And then soon, and just recently, I'm going to not say his name correctly, but Jan Tervaart from the Netherlands, who now resides in Canada, wrote an article that will be coming out in its entirety called Breast Implant Illness Scientific Evidence. And so he uses the Bradford Hill criteria to diagnose, to formally diagnose. And so that's a big deal. And then also, I don't recall, I think we were just learning about something called silicone-induced granulomas within the breast implant capsule when we last talked. So Dr. Eduardo Fleury, he's a PhD, MD, oncology radiologist with a breast specialty in Sao Paulo, Brazil. And he's just with a regular breast MRI, ideally it's with contrast because you can see more with contrast. And if you have a breast MRI with or without contrast, you can take a look. It's a special training that they have to have for the silicone-induced granuloma. If you have this silicone-induced granuloma, then you know you have an inflammatory cascade that your body has to deal with. And that's all that it means. It doesn't mean you have BII. It doesn't mean, you need to do all these things. It just means you have an inflammatory cascade. And in this breast cancer population, inflammation, oxidation is a big deal that we want to curtail. I thought gel bleed meant the gummy bears, the gel silicone, and gel is just the shell. Gel bleed, diffusion rates, openings, how the shell, it's all about making that shell as protective for you, whoever has the implant. It's all about trying to make that shell protective, and stuff still gets through. Like, there's so many physicians just doing explants right now that you can see their pictures of the end block or the capsulectomy, and you see these two different implants, left and right, and maybe the right happens to be discolored and the left is pristine, and you wonder what's the differences, right? So this is oxidative, this is gel bleed out and gel bleed in, and so we know that this occurs, and now we're learning that the changes of oxidation can really impact some people. And it's actually, in my opinion, the majority of people, it's just a matter of when, right? So the woman with breast implants that is questioning, or even if you're not questioning and you just want to know your baseline, now we have something called SIGVIC, which is the silicone-induced granuloma within the breast implant capsule that radiologists can identify. Where we are right now is that not all radiologists know about SIGVIC. So for those who are interested, connect with myself, or actually connect on the Breast Implant Health Summit page, and then we will get you to Dr. Eduardo Fleury. And ideally, we would like to work with your radiologist in your town to learn how to do SIGVIC. And so for anyone with breast implants, reconstruction, augmentation, I think they should begin to ask for SIGVIC. And that's an easy one. If you have SIGVIC, then finding a practitioner that can help you optimize your path, your nutrition pathways, your digestion, your drainage pathways, your methylation pathways. That's the goal. And for me, that's usually an integrative health practitioner, a naturopath. And Australia has some phenomenal naturopaths, functional health, functional medicine practitioner, someone who can understand methylation in the Krebs cycle. So then there's the next level of people who have maybe even explanted already because they have all these things, and the majority do find wellness within that. some don't, like, and you need to find an expert provider that understands how to deal with the different sensitivities and start really moving things in a different way with maybe a genetic patterning. And I think that if you are that population, reach out to the Breast Implant Health Summit, which is actually myself and Terry Diaz, right? And we will do our best to navigate you to where you need to be. If you are a practitioner that doesn't know but really wants to help, then again, within the Breast Implant Health Summit page or my email address, I will gladly, we will figure out how to teach that practitioner how to help that person.